Okay, Doc, welcome back for another question in immunology. So in this case, we're going to read the last three lines like we always do. Please follow the same formula. If you work on a certain skill to get better at it, you just got to keep repeating it over and over again and fine-tuning whatever the skill is, right? In this case, it's reading the last three lines, being comfortable with reading the last three lines. Typically, students read only the last line. And what happens is they leave valuable information to at the end when they read the scenario versus wouldn't it be nice if you read the last three lines and get some valuable information right away? So let's try this out. The spleen is palpated 2 centimeters below the left costal margin, so splenomegaly. Leukocyte count 14,000, 54% lymphocytes, 12% atypical lymphocytes. Okay, so leukocyte is usually 4,500 to 11,000. That's pretty high. And again, open up the labs and you can see it yourself. So there's an infection. Results of a heterophile agglutination test are positive. Oh, ding, ding, ding. There you go. Results are positive for heterophile agglutination test. This patient is at increased risk for which of the following conditions. So do you see, by reading the last three lines, you know the person has splenomegaly, the girl. She has an infection, atypical lymphocytes, and there's some lab work, some results came back. A positive test for heterophile agglutination test. So now we need to know what the condition is. Fair, right? Hopefully you know. If not, we'll walk through it. Then they say the patient is at increased risk of which of the following conditions? For which of the following conditions? So we need to know associations now. You see, that's why step one can be challenging. For many, many reasons, it's not just straightforward, hey, here's a question, here's the answer. They want us to see what the patient has, and then after that, know what associations come with that condition. Like, what are they at risk of getting if they have this disease, right? So, typically, reading these lines, you should have an idea what this means. If you do not, it's okay. Let's go to the top and read the scenario, because now they're going to present to us a case. The case will have enough information for us to figure out what this poor girl has. So 17-year-old girl, right? She comes in because of a sore throat, fever, and fatigue for the last 3 weeks. Not good. Her temp is 100. Okay, and we talked about this before in previous videos, 100 degree Fahrenheit. It is, on the higher end. It's not 98.7 or 99.1. It's showing us that there is some temperature. Pulse is 97, okay, and blood pressure is low. Examination of the head and neck shows cervical lymphadenopathy, pharyngeal erythema, enlarged tonsils, exudates, and palatal petechia. Now, this should trigger something. What are you thinking? Well, I'm thinking infectious mono. So infectious mononucleosis, what is that? That is a herpes. There's many different types of herpes, right? Different families. There's herpes types, type 1, 2, 3, 4, 5, 6, 7, 8. So EBV, right? Mono is 4. 5 is what? 5 is CMV. 3 is chickenpox, right? And the way I remember EBV, mono, is Epstein-Barr, B-A-R-R. 4 letters. So it's type 4. 5 is CMV, 6, 7 is roseola, 8 is Kaposi sarcoma. So we need to be able to read the scenario, figure out that this means infectious mono, okay? If this was not the point of entry for yourself, then you go to the scenario itself. And the scenario leads us to fatigue and sore throats and fever for many, many weeks, not just a couple of days, and swelling, right? So now we know it's infectious mono, okay? I'm going to use AMBOSS just to show you why I love it so much. Hit the attending tip. Now, I ask all my students to use the attending tip, usually to confirm. So now we already knew it was infectious mono. I said it to you, you said it to me, we said, Doc, it's IM. Okay, great. We're using the tip to confirm because it would be upsetting if we thought it was mono. We went ahead, eliminated all the answer choices but one, came down to the answer choice and it was wrong because our thought process was not where it was supposed to be, right? So it's okay. I mean, when you're studying and you're working, you're practicing, preparing, do this for now, right? Come up with your own differential, hit the tip to confirm. So it confirms infectious mono, right? Epstein-Barr, B-A-R-R, type 4, right? Herpes. Good. Now, what is the answer? This patient is at increased risk. Be careful. That's why you always read the last couple lines twice so you don't make a mistake, especially when you're under stressful timing, like the actual exam. So it's good to practice. Rheumatic fever, Kaposi sarcoma, hepatocellular carcinoma, Hodgkin lymphoma, mycotic aneurysm. Now, it's challenging because we need to know it's Epstein-Barr, mono. Risks. What risks? Well, Kaposi sarcoma is 8, and we know that this is 4. We said Epstein-Barr was 4, and this is herpes 8, so that's out. We know that hepatocellular carcinoma, it's usually hepatitis B and C, all right, but you would see like jaundice and other symptoms, and that's out. Rheumatic fever, what does that trigger? Well, it triggers group A strep, right? Strep pyogenes. So in this case, you don't see strep pyogenes or symptoms of that, so that's out. Now we have Hodgkin lymphoma and mycotic aneurysm. So it's challenging, but let me ask you, mycotic aneurysm, what does that sound like to you? Well, it should sound like infectious endocarditis, infective endocarditis. So, i.e., if it's infective endocarditis, what do you want to see in the case? A cardiac involvement, plus other like Osler nodes, Janeway lesions. So again, because a person might have a fever or is weak or fatigued, that's great. But remember what I've told you over and over again. You have to take all the symptoms and signs that present in a given disease and say, well, I want to give this person a condition or say that you have increased risk of getting this. But in order for me and you to be comfortable and be confident to give this differential to the patient, we have to see, do they fit the criteria of the symptoms and signs? So in this case, mycotic aneurysm, infective endocarditis, this doesn't present like infective endocarditis. It's not. You would see more cardiac involvement and other issues, like we said, nodes and Janeway lesions, right? Osler nodes. It's not that. So because of that, we knocked this out. So do you see the power of combination of reading the last 3 lines first, grabbing valuable information, atypical lymphocytes, she has a fever, and this beautiful line right here, which triggers EBV. Hopefully it does, and it will do now. That there, you can actually answer the question. But because we want to be thorough, we go to the top and read the whole scenario. But typically, if the person says, or the test says, hey, this person tested for this, this is the disease. So you see, learning these skills and tricks can help you not speed up, but save time, because there's going to be some questions that you might need to invest more time in because you're not as strong in that material, for example, right? So you did this in, let's say, 30 seconds. Another question coming down in the block, you might take 4 minutes because you just need to read it. It's too long, it's too involved, it's too saturated, or something you don't like, right? So that's why take these skills and use them each day, and you will get better and better as you keep practicing. So Hodgkin lymphoma, there it is. And it's yellow or this kind of color because you use the tip. Read everything. It's important, like I always tell you, you need to be able to see these kind of triggers or these kind of clues to say this is related to infectious mono. Infectious mono, Epstein-Barr. Epstein-Barr, herpes type 4, right? Boom, Hodgkin lymphoma. And if you didn't know that, now you do. Hodgkin lymphoma is a potential complication of infectious mono. Now, just to be honest, maybe it didn't come to you. Maybe it didn't come to you right away. But you see, if you're taking your time to knock out every other answer choice, by default, you have the right answer. It wasn't rheumatic fever because that's gas, meaning group A strep. Kaposi is is herpes 8. This is herpes 4. Hepatocellular carcinoma, that's hepatitis B and C. And mycotic aneurysm is effective endocarditis. So by default, by elimination, the answer is D. And then if you didn't know it, that's perfectly fine. You take your time, read the information, take some notes, and understand that this is a complication of this. And this is why the exam is challenging, because it's not as fair as we all think it is sometimes. You need to be able to read the scenario, gather the information. Either A, the pieces are in front of you, or B, you need to know something from here. Like in this case, you needed to know that Hodgkin lymphoma is a complication of infectious mono. But if you're able to knock out the other answer choices with a little extra, work on learning more information per disease and scenario you come across, you have the power to knock them out. And then, you have the answer right in front of you, right? So practice that. It's definitely very, very vital, especially when it comes to long questions with multiple answer choices. You might have 7, 8, 9 answers listed, and it's going to be challenging at times. So practice a skill from now, and I promise you're going to feel more confident on exam day. All right? All right. I'll see you guys on the next question.